Right.
That's right.
The goal is to set up partnerships with existing healthcare clinics around Chicago. Through this partnership, the clinics will commit to becoming physically accessible, providing accommodations like sign language interpreters for deaf patients, and making sure the clinic promotes the fact that they are accessible. Because that's the issue too. Lots of major university hospitals are accessible, like UIC included. But do they promote this in the disability community? Do we know that they are accessible, right? We want them to promote this at health fairs and to Access Living and other centers for independent living. They should be there. And another goal is to have an ongoing relationship with the medical community and staff in Chicago, where we can have open discussions and community meetings, creating more access for people with disabilities.
Yeah. That's right.
All right, I'm not the only speaker. Lots of people have helped me organize this today, including Judy Pecco-Reese. She was the former Disability Women's and with Disability Center at RIC, which closed in 2009, and now she's the healthcare policy analyst at Access Living. And she's going to talk a little bit more about accessible healthcare. My name is Kalani Flasher.
Hey, thanks for coming out. Doctors, nurses, what do we want?
Accessible healthcare.
Accessible healthcare for me and you. My name is Judy Pecco-Reese. I work at Access Living on women's health issues. One of the things Falani talked about is there's no research on women's health for women with disabilities. So what happens is when we go in and we make our demands and we talk about the barriers that we face, we say, well, where's your data? Where's your research? We're our research. We're our data. And before I finish, we're going to meet Dr. Susan Magazine, who's on faculty here at UIC and has been working with the disability community, especially women with disabilities, to get that data and get that research. But all these years, Access Living has been working to get access to education, to employment, to the buses and the trains, to the very curb cuts that we rolled up and down today. Access Living did that. Now, who would have ever thought that we're here all these years after the American with Disabilities Act, and what we want is access to health care. This comes at a good time. The FIFIs have made it a really good time. Now that Obamacare is pitching in, this is the time to make sure that women with disabilities are able to get mammograms, to get pap smears. We shouldn't have to call in advance to get sign language interpreters or to find out if the tables are accessible or if there's somebody there to help us get dressed and undressed. And we just shouldn't have to make those extra phone calls. We will know that our work is done when we just call and make an appointment and show up in our wheelchairs, show up with our needs for sign language interpreters, and those services are just automatically provided. That's what it means to be accessible healthcare. So this is a very important message, and people don't always realize that people with disabilities really do not have equal access to healthcare. This is what our charge is. This is what is fair, and this is what we need right now. I'm going to introduce Dr. Susan Magazine, and she's going to talk about why we need research for women with disabilities and people with disabilities in the healthcare.
Thank you. This is fantastic. Thank you for inviting me. My name is Susan Magazine. I'm a faculty member here at UIC, and I've been really lucky for the last many years to be partnering with the Healthcare Access Policy team at Access Living to work on the issues of healthcare access for people with disabilities. And, Falani and Judy have both laid out the key issues. Lack of access, lack of accessible exam equipment, lack of research. So we've been lucky in the last couple of years to get some funding, first through Northwestern University to look at access to health care for Medicaid beneficiaries here in the Chicago area. And now we're currently doing some research funded by the American Cancer Society to look at breast and cervical cancer screening for women with disabilities. And I just want to echo some of the findings that Falani's shared with your group that you found, that we also found in our larger study with people with disabilities. And I wanted to really highlight those issues at the provider kind of level, things that providers and institutions need to be doing differently. What people were telling us is that their providers, so nurses, doctors, as well as all of the people who work in the clinics, were not having a good understanding or a good respect for the needs and the rights of people with disabilities. So what people were feeling is that disability experience wasn't valued, and as a result of this, that was leading to this failure to provide appropriate accommodations. So things like accessible exam equipment, things like access to our interpreters are sorely lacking. But also the issue of providing needed assistance during that medical appointment, where people are being asked to bring their own PA with them to help with transfers, which is not appropriate and not legal.
It's illegal.
It is illegal. And what this does is it compromises the care that people are getting. You can't get access to a quality health screening if you're sitting in your wheelchair. There's a reason people are examined on an exam table, and we need to make sure that people with disabilities have right to that. If we're not providing good interpreting services, the doctors can't ask us the right questions, and we can't tell them what we're experiencing. So these are vital, not just to the experiences that people are having, but the quality of the tests we're getting, the outcomes that we're receiving. And this is all targeting what we call in the medical field patient-centeredness, patient-centered care, so that you're appropriately targeting services to the individual. But if we're not accommodating, and we're hearing from people over and over again that people are not accommodating the healthcare needs of people with disabilities, they're not going to get appropriate tests, appropriate screenings, and appropriate treatment for the services, for the issues they're dealing with. The thing that we were finding that I found really interesting with our study is that the disability community is really savvy. Y'all know what your rights are and what you deserve in the healthcare setting, but even when you're asking for them, you're not always getting those rights met. And then there's a lack of recourse of what do we do if our needs aren't met? And we heard from people that they would just leave a healthcare encounter, but that's not a good solution, right? Because then people aren't getting what they need. So again, we just need to keep the pressure on. We're building this body of evidence to take to lawmakers so that when we have these discussions with providers, we can say, here's the data and here are the stories. So we thank everybody who's been participating in our work. We do have some studies going on right now looking at breast and cervical cancer screening, specifically this time for women with physical disabilities. We'll be around after, so if you want to talk to us about that work. And also, I would love to work with the FIFIs on building on the work that you've done to move it from, the really great start that you've had to research and evidence that we can take to policymakers and lawmakers. So thank you.
All right.
So our next speaker is Empowered Fifi. Her name is Joy Grant. She's kind of new. She's been around for about a year now. And she has been very enthusiastic about this march from the beginning when we started planning about a month ago. So give it up for Joy.
Hi, I'm Joy Grant in the Powers of Fifis. And I am so glad we are here because we care and demand accessible and quality Medicare. And in the past, when I go see my doctor, the exam tables are very difficult for me to get up on because I don't want to hurt myself. And it's just hard for me it's very embarrassing when you need help. You have to use a chair and you can't get up there because you don't want to hurt yourself. So nurses give you a chair and you have to make sure the chair is steady and you have to get up there even though it has 2 steps, small little steps, but I still can't balance myself and it's very hard. And it makes me feel like I don't even want to go to the hospital or to see a doctor because it's so hard and embarrassing, and they think you're not really care, and sometimes they're impatient, and you know, it's just like it's very hard for people like us to demand attention, and sometimes we just need a little bit more accessible. I didn't even know we have accessible exam tables until I wish they did, but it's not a wish. They do have it. They can give it to us, and it's just.
That's right. Give it to us.
Every one of us should deserve accessible and quality from nurses and doctors.
Right.
Everyone. And that's My name is Joy Grant from the Powers of VP, from representing Access Up.
Yeah. I want to do a VP!
Thank you, Joy. You're awesome. So, our next speaker.